Hi everyone, today we are going to be walking through a pretty standard neurotoxin treatment. So for this gentleman here, we are treating his frontalis, glabella, as well as his crow's feet. So starting up on his frontalis, I marked my lateral border there, and now for my injection points, we are staying pretty high above his brow. For him, as you can see, he has a very strong muscles, so we do a pretty hefty dose, but we like to try to balance out giving him a dose that's going to last 3 months, but is also going to freeze that muscle enough to where we're getting a result and kind of helping with those fine lines. So for him, we do stay quite high above the brow because I want to be able to give him a higher dose, but I don't want him to feel that heaviness or drop his brow at all. So now we are going in and marking our glabella region, so the procerus as well as the 2 corrugators. Again, he is so strong. He's probably my patient that gets the highest dosing just for these areas here. But we are just marking up here, so glabella and then my corrugators. I like to do 2 injection points for my corrugators, so I mark those accordingly there. And then going in for crow's feet, here I did 5 injection points. Again, it's really important to be treating where there's a movement. If I weren't to follow that movement along and come in medially with my last point there, he would end up with almost a shelf-like appearance. So we want to make sure we're catching all of those muscle fibers. Now we are going in and treating. So in my syringe, I have my neurotoxin as well as a little bit of saline just to help spread. He does have a larger surface area here that we're working with. Whatever amount of units I drop into my syringe, that is the amount that I am administering. But I just needed a little bit extra in order to make sure that it was evenly spread across the area, especially because we're going a little bit higher here as well. So just going in and injecting each one of my points that I marked out. I don't inject right into my pencil, obviously, so just going right next to those dots. And I have the patient turn with me just to make myself a little bit more comfortable while injecting and making sure that we aren't missing any injection sites as we go across. My lines, my lateral borders, are just marking off where the temporalis starts. If you were to go too far lateral, you're not going to cause any sort of complication. However, you're just kind of wasting units. It's not treating the muscle that you're intending. So we want to make sure that we're only treating where we're, wanting to treat. Again, I'm making him make an angry face and then going in with my toxin. For the procerus, I go straight in 90 degrees. And then for my corrugators, I like to come almost parallel with that muscle. It is very important to maintain a good depth when treating the corrugators because that frontalis runs right underneath and we do risk dropping the brow if we are injecting our product too deep. So here I'm going about 3/4 of my needle there and then about half for that next injection point. He is also a male and he has huge corrugators there, so for him, it's not as big of a concern as it is for maybe someone who's a little bit more petite. Now I'm going in to my crow's feet here. My needle is slightly more superficial. I'm always pointing away from the eye and just following my injection points along. As you can see, I just follow along in the natural curvature. Same thing on the other side there. I just checked and make sure that I was outside of that orbital rim. And then going in and doing the same thing on this side. For him, we do even dosing, so the same units on both sides. It's not always the case for everyone. Some people need a little bit more, particularly on the left side, because that's the side that we drive on. So sun damage, things like that, or maybe the side that the patient sleeps on. Doesn't have to be equal, but for him today, it was, and that's his treatment.